My name is Kwame Terra, CEO and founder of Behr Health. Behr Health is a startup company based here in New Orleans committed to maximizing health in the Black community.
I used to do cross country, and there'll be moments during, let's say I'm on the fourth lap and I'll be like, why am I even doing this? Like, I'm exhausted. I'm tired. Like this makes no sense at all. How has that experience kind of prepared you with regards to being disciplined and having endurance when it comes to being a founder now? It's a long sprint. It's a journey and a half. How has that experience prepared you to be a founder?
Yeah, I think a long sprint is such an appropriate description of building a startup. The historical context really is everything that motivates me to do this. So we've been here for 400 years, and there's not a single thing to me that indicates that the country is going to go out of its way to change. The country, or our system, though equipped, just ultimately wasn't designed to solve this problem for Black people. And so instead of trying to go in and change the system, I just figured we'd create a new one. Just to name a few of the historical events. I mean, at one point, so right after the Emancipation Proclamation, several Black medical colleges and universities were started. Howard University, one of them, or Howard was the first one. And they got up to about 8, but then the country changed some standard for medical training. Again, they said we're just raising the standard, but it really ultimately it knocked off 80% of the medical schools that trained Black doctors. And we know for a fact that when a Black person is cared for by a Black doctor, the outcomes are better. This isn't a matter of race or opinion. It's just the data shows that. And so they took health away from Black people right there. We were on our trajectory. It's just one example.
So I just want to take it all back before you actually started the company, before Step Record. What was your life like? What kind of brought you to this point in time? So can you just take us back a little bit?
Yeah. I guess I can start in childhood a little bit because I think it's important. So I grew up in a family of runners. 4 out of the 7 children we ran. I focused more so on baseball in my early days, but eventually, and my goal was to become a professional baseball player. But my junior year of college, the track and cross country coach at Xavier University, Louisiana, reached out and said he'd pay for my school if I decided to come here and run. And even though running wasn't my primary, goal as it related to the sports, it paid the bills. So me and actually my sister went to Xavier University in 2011. My older brother, he ran cross country and track at Wisconsin, one of the top programs in long distance in the country. Younger brother won state didn't win state. He got 5th place in state in the mile in his senior year of high school. And so just again, competitive family of runners. And my dad was always strict with us about what we ate, right? So we often ate, beans and rice, like pretty much a staple. Beans, rice, beans, broccoli, and some grilled chicken. Like that was a pretty consistent meal in the house. And that was I guess you could say the original seed of just being more health conscious.
Yeah.
And ultimately, part of the reason why I decided to go to Xavier was to become a doctor. So for those who don't know, Xavier University, Louisiana in New Orleans produces the most students who go on to complete medical school, most Black students in the U.S. that go on to complete medical school. And so there wasn't really a better place for me to go to accomplish that goal, which was again my original goal was to become a doctor. And yeah, that's how I got to that point. From undergrad to starting Behr, I started off with pre-med, but I got introduced to research early and developed an appreciation for addressing problems from the root cause of the issue, as opposed to treating the condition once it's already developed and you're in the clinic. And then that kind of opened my mind up to the focus of prevention and public health, which, for those who don't know, public health is the art and science of prolonging life. And there are a variety of factors that go into what it takes to prolong life beyond your engagement with the healthcare system. But that accounts for about 10% of your health outcomes. The majority of your health is determined by how you engage with the world. And so I wanted to spend the majority of my time in this work in that, 80% that drives health outcomes. That's how you live, where you live, your perception of your life, those factors that really, even if you're going to the doctor every year, if you're not taking care of those areas, doesn't matter how much you go to the doctor, you're not going to be well.
Yeah.
And so between undergrad and graduate school and before came up with the idea for Behr, I really just traveled and tried to get to know myself on some level, tried to decide exactly what I wanted to spend my time doing. I worked at the airport. I lived on farms. I drove Uber and Lyft. That's a variety of things. I traveled to different
Just
conferences.
tinkering around.
Yeah, just keeping my expenses low. I will say that the biggest thing I learned during that period was how to live with a little.
I just want to touch on your love for sports, specifically cross country. Those are very endurance driven, disciplined sports. I used to do cross country and there'll be moments during, let's say I'm on the fourth lap and I'll be like, why am I even doing this? Like I'm exhausted. I'm tired. Like this makes no sense at all. How has that experience kind of prepared you with regards to being disciplined and having endurance when it comes to being a founder now? It's a long sprint. It's a journey and a half. How has that experience prepared you to be a founder as well?
Yeah. I think a long sprint is such an appropriate description of building a startup company. Again, I've been doing this, running my whole life, and there are just certain parts of me now, certain characteristics that I have that are all directly reflect my experience as a runner, right? So you're spending the majority of your time running at a very easy pace, but this is, it's a week. 80% of your training is just easy running, do the fundamentals, if you will. And when I think about that as it relates to business, people are often asked me like, how have you achieved this much success in your first try as a startup founder in this period of time? And it's because the majority of my time I'm in here applying to programs that lead to incubator acceptances. I'm applying to pitch competitions. Like this is what I do every day. And this is the work that I every night can lay down and feel proud of myself that I accomplished. Not necessarily the outcomes. The outcomes isn't what I'm focused on, right? It's the activity. And so it really helped me develop just an appreciation for focusing on the activity that leads to the ultimate outcome. Because the thing about running, and it's also true in business, although less true in business than it is in running, you're never going to outperform the work you put in. Period. In running, you will never outperform the work you put. You're not going to suddenly have a burst of, aerobic capacity, and all of a sudden you can run a 5 minute. It doesn't work like that at all. I do think that there's luck in business sometimes, or happenstance and things like that do happen in your favor. But I don't like to rely on those things. I prefer to rely on that which is within my control, and I take the blessings when they come. But I knew early on in my journey, when I started about 2.5 years ago, that one, this was my first time. And so there's almost certainly a bunch of stuff that I just don't know. And as opposed to me going in like, learning through experience exclusively, let me find a way to surround myself with people who have already done this so that I can avoid some of the mistakes that they made in the past. And so I applied to in 2023, when I first started working full time, probably about 80 startup accelerator and incubator programs in that year, which is, I would say, probably 10 times more than any of my friends who maybe were in the same space. And we got into about 8 programs. And so now I have this ratio, right? And we raised about 70 grand. Again, first year in entrepreneurship, full time. First year as a startup founder, we bring in 70 grand. And that's a good indicator, right? It's not a bunch of money per se, but I was able to eat. I was able to grow, and I also now had access to a network of people from different parts of the country and in the startup ecosystem. And so, but again, it was rooted in how many applications can I do? That's all that I was focused on. How many times can I put my story out there? And ratio, again, 1 out of 10. So now if I want to get into 8 programs this year, then I need to do 80 more applications. And so between 2023 and 2024, I applied to about 120. We got into close to 12. And we brought in like $250,000, and that's been enough to get us to where we're prepared to launch our official app in October. But yeah, like I said, man, it just ultimately comes down to me, the relationship I have with the core of the work. Mm-hmm. The outcomes, I'm not even thinking about the outcomes. I just know that this activity gives me my best chance at the outcome. I really don't think about them.
And the other thing when it comes to being an athlete and being a founder is silencing those voices of doubt. How have you gone about silencing those voices?
I just work harder. Like it's like fear only creeps in when I don't feel like I'm giving myself my best chance. Fear and doubt only creep in when I don't feel like I'm working as hard as I can. And but at the same time, still maintaining my health. Like my 3 priorities are my business, my health, and my family. I like to say on special occasions, because relationships can be distracting when you're trying to give birth, or just in general, right? They require a lot of your heart, when things aren't going well with you and one of your parents or your siblings or friends even, it's like it weighs on you and it'll distract you. And it's not that I don't care about these relationships. It's just for this short season, I just need to minimize the number of things that are going to take me off my base. And so I'll see you at the bachelor party. I'll see you at Thanksgiving. But outside of that, you're gonna have to catch me at one of our events. But yeah, it's whenever again, I don't really think too much about the outcome, and when I do feel myself getting pressed or stressed out about like potentially not achieving an outcome, I just think a bit bigger, right? So that I can leverage that vision to motivate me and pull me more. And then I just do more work. Because you think about it like this, if you are taking 2 or 3 shots, you're going to hang on every one of those shots because, well, they don't hit, then you fail. But if you're taking 1,000 shots, you don't care which one hits. And so that's how I feel about it. And at the beginning in 2023, when we first started this, I was, I didn't have an income. I actually had paid suspension from the job I had just got fired from at the airport for 3 months. And so for 3 months, I sat in this office all day and I applied to programs. And then after that 3 months, like literally as soon as my paid suspension ended, we got into our first program, $1,000 check from Brent Fayez. That was our first 5-figure check into the business. The next month, we got $15,000 from an incubator here in New Orleans. The next month, we got $25K from another incubator based in, I think it was Nashville, or actually they're kind of all over. And it got to the point where like we were getting accepted into a program like every other week. Every Friday, I'm just waiting on a message from a program. And there were programs that I get into that I forgot I applied to. That's how much work I like to do to mitigate the fear, because the fear is always going to be there.
Mm-hmm.
And I think the most strategic thing that I've done is detach myself from the outcome and focus on getting my value from the work, like the activity that I know leads to the potential outcome. But yeah, that's it. If you have fear and doubt, do it scared. Like don't worry about eliminating it. Just keep shooting. Yeah, like that's really hard to do. And that comes with time. Every time we go through a financial downturn now in the business, it's not as scary as the first one was when like I was stressing like crazy. But now like, there's been 2 or 3 since. I have data now to show that whenever we do go through one of those, there's some sort of bounce back after. And so now I'm just, okay, cool. We're down right now. In a few months, we'll be up.
And I want to touch on the main thing, redefining healthcare for the Black community. And for years, if you look at the USA, there's this systematic oppression that was placed within the Black community. How has that driven you to kind of start on this journey of redefining what it means to have a health system that operates for the community?
Yeah. I mean, the historical context really is everything that motivates me to do this. I don't believe too much in intent as it relates to when things don't go the way that maybe they should. Let's say, hypothetically speaking, the country on some level said it's committed to maximizing health in the Black community, all communities. That's a great expression. But the outcome and the reality is that there's a stark disparity between Black people and the rest of the country as it relates to health and relates to everything, really. And so to me, that was the intent. The outcome to me was the intent. I'm not necessarily saying that it was a conscious intent, but there was somewhere within the system or within the individuals that drove the system. This was the intent, because that's just how the world works. So reality follows our focus and our emotion. And so here's the outcome. So that is what it is. I'm not of the belief that it's written anywhere that anyone is really entitled to any type of quality of life care. And it just so happens that in this time, there is a group of people there are a group of people who don't want Black people to be healthy. Okay, that's something that we have to contend with. That is within the strategic planning for Behr Health and for Black people as we work to achieve maximizing our health. So we've been here for 400 years, and there's not a single thing to me that indicates that the country is going to go out of its way to change. The country, or our system, though equipped, just ultimately wasn't designed to solve this problem for Black people. And so instead of trying to go in and change the system, I just figured we'd create a new one, right? Involve Black people from the very beginning in the process, an approach called community-based participatory research, where You invite the community that you aim to serve in as equal partners in the design and development of products and services that you aim to create for them. And we just do it right. And we only have to do it right once, right? And defend it.
Yeah.
It's not like, because a lot of people will say, hey, why don't you just try to figure out how to integrate with the healthcare system? Again, healthcare system isn't even really a healthcare system. It's a disease management system, acute care system, which is fine. That's, again, what it was designed to do. And it does a decent job. It keeps a lot of sick people alive, and it treats acute situations. And what I do isn't for that, right? I'm trying to create health. And so, instead of trying to change the problematic system that we have, my goal is to create a system that's free from the shackles of racism that infect the current one, and integrate health into Black culture, right? Placing it at the core of how we live, learn, work, play, and celebrate in the Black community. And I don't want health to be this extra thing that people feel like they have to do to be well. I want it to just be a part of our lives. Because when you look at the blue zones, parts of the world where people are living into their 100s on a regular basis, there aren't all of these extra things that people do for their health. It's just that the way that they live promotes health. They eat dinner with their family. They walk to work, right? They have significant purpose. They're in community all of the time. So how do we just curate that, right? And ultimately maximize health in the Black community without it feeling like you have to get this gym membership and go jump in the sauna and then the plunge, and then you got to track your calories and your macros. And like, they're not doing any of that over there at all.
Yeah.
They're just living
It's
well.
just extra strips.
So how do I help curate experiences and environments that people, just by living their lives, they become healthy? That's really that's what I mean by integrating health into Black culture. But yeah, I mean, just to name a few of the historical events. I mean, at one point, so right after the Emancipation Proclamation, several Black medical colleges and universities were started. Howard University, one of them. Howard was the first one. And they got up to about 8, but then the country changed some standard for medical training. Again, they said we're just raising the standard, but ultimately it knocked off 80% of the medical schools that train Black doctors. And we know for a fact that when a Black person is cared for by a Black doctor, the outcomes are better. This isn't a matter of race or opinion. It's just the data shows that. And so they took health away from Black people right there. We were on our trajectory. That's just one example. But ultimately, when it comes to health and the health or the life expectancy gap that exists, it's driven by what are called social determinants of health, right? Quality of life metrics, if you will. And quality of life is what must be restored or granted to Black people if we were ever to achieve health equity, right? Black people and everyone else living having the same life expectancy. And just decades of injustice have taken quality of life away from people. And once it's restored or granted for the first time, then you'll see health. It's very simple.
Yeah. And your way of kind of voicing this thing was by taking 2 million steps in 30 days. Mm-hmm. There's no way. Like, I love running, but there's no way I'm doing that every day. How are you waking up in the morning? What are you eating in the morning? How do you feel? How's your body? Like, take us through that journey.
Yeah. Let's just say the day after I was done, I think I walked maybe 500 steps total that day after I finished. That was, I don't know if it was the hardest thing I've ever done. Physically, yes. Mm-hmm. Like, psychologically, not necessarily. There have been like harder challenges for sure. I'll tell a backstory on how steps even became a big part of the culture in the Behr Health community. We started off in January 2024. So the app has actually only been out. Our beta app has only been out for 18 months. We have about 2,500 users on the platform. And again, walking has become a big part of the culture. And it started when we did the Mardi Gras Steps Challenge in 2024. A little over 100 people joined. Whoever took the most steps won $5,000. And that was the challenge. And so people were walking. Like one person did 100,000 steps on the first day.
Oh, damn. Just incentive.
Just to let everybody know that they're not going to beat him, But it was crazy. It was crazy. By the, literally people woke up at 8 a.m., ready to take on the challenge that had started at midnight. And he already had 40,000 steps. They were like, oh, wow, well, he's cheating. I quit, all that stuff. And his strategy definitely worked. He did end up winning. But a lot of people who were in the challenge just reported the mental health benefits of walking and being in nature, or just learning how walkable the city is, and just shifting their perspective on what they even consider a long walk now. So that was really valuable. And then about 3 or 4 months later, Dr. Eric Griggs did 1 million steps on our app in 30 days. And he lost 20 pounds and got taken off his blood pressure medication. The next month, he passed me the baton. I did 1 million steps in 30 days, June 2024. Another user did it in July. 2 users did it in August. And then another one did it in October. And so now we're all just like these big steppers, if you will. And we get to talking, and we're like, hey, what do y'all think the world record is? Do you think any of us can go after the world record? And so that's how that conversation started. And I told them that I wanted to do it in 2025, just based on timing and everything. I decided to go after it in April, as we get ready to prepare for the official launch of the Behr Health app. So we'll be migrating from our beta app to the official app this fall. Yeah, I actually decided 3 days before the month started that I would go after it. Woke up at 5 a.m. on April 1st, did like an hour walk, and then I drove to the track where I had practiced. I was coaching some of my run club team members, and I'm just walking around the track as they're doing the workout. And then I go to the school and I walk around the fitness center all day until I rather walk somewhere else. And then I walk downtown. I walked with a friend for a couple hours. We got some food, walked them back home, and I actually finished my steps at like 11 p.m. on the first night, my 67,000 for that day, walking around my friend's island, because I was like,
so this is from 5 in the morning to 11.
Yeah. So I was on my feet typically. I was on my feet for about 14, 15, 16 hours a day. Not necessarily walking all of those hours, but yeah, every chance I had, I was walking, because I just didn't have time. I didn't have time to do anything else, right? And so now I lay down after that first day, and I'm just like, man, how am I going to do this for 30 days?
Yeah.
30 whole days. It's going to be kind of crazy. And the first 5 days were absolutely brutal, because I'm using different parts of my legs walking compared to running, and you don't get as much rotation, so you're a bit stiffer, and it was painful, man. Like, I learned about different parts of my body that I didn't even know existed because they were in pain. Every time I bent my knee, like, I couldn't even extend it without it just feeling like I'm about to snap a rubber band or something, like, from the tendons. Yeah, it was bad first 5 days, man. Eventually I would actually have to warm up. I would have to do like a half a mile jog before I started walking, just to get things flowing and get some flexibility there, that was honestly one of the most fascinating things about the challenge, is that I literally had to run to walk.
And how did you deal with that pain though? Like, how did you mentally overcome that pain, especially like the first few days?
Well, I guess on some level, I assumed it would go away eventually. And that if I'm doing something, my body's doing something that it's never done before, so obviously it's going to be sore. But if I'm good about making sure that I get to sleep, and I eat a whole food plant-based diet, so able to recover quicker, then I would get stronger each day, and I wouldn't be fatigued. Like, that was kind of like my thought. It's like, okay, knock all these steps out, make sure I get some rest, my body will heal, and it'll come back stronger the next day. So that was the initial thought, but it took about 6 days. And also on like the fourth day, I started getting sharp pains in my head because I wasn't fueling properly. Yeah, so that actually made me really nervous, right? So, middle of the day, getting sharp pains, walking around, cool. But like, I was laying in my bed at night, and I was still experiencing the stabbing pain in my head. And I was like, I mean, I want to do this, but I don't want to risk my life,
Yeah.
And people started bringing me food, making sure I was hydrated and stuff like that. So definitely leaned on the community to make sure that I didn't put myself at risk. But the main problem I had ultimately after the first 5 days and my body started to adjust was my Achilles tendon. My left Achilles tendon started to flare up. So one night, it was a Thursday evening, maybe 10 days in, I'm doing kind of like a cool down jog with some of my run club team members, and I just started experiencing significant pain in my left Achilles, like 10 out of 10 pain. Right? I can't push off without significant pain. And now I'm just like, okay, well, what's going on here? The thing is, I was actually preparing, before I started this challenge, I was preparing for a 10K. I wanted to, me and my team members have been preparing for this 10K called the Crescent City Classic in New Orleans, like the biggest race in the city, 20,000 people. And this has been like our big, pop out race that we've been preparing for. But I decided that I was going for this challenge, and I wasn't sure if I was going to do the race. And so now that my Achilles is flaring up, I'm like, oh, I'm definitely not doing the race. And so fast forward a week, it's the day before the 10K, and I still really want to run, but I'm just, again, I don't want to risk it. I
literally not feeling it.
I still can't push off. It's been a week, and I still cannot push off without 10 out of 10 pain. And so I'm walking around the expo at the event, or the expo for the race the day before. And because Behr Health, we had a booth there, and my interns are working the booth, and I'm just walking around the expo getting steps. Because again, I still don't actually have time to do anything else. And this is like maybe day 18. And as I'm walking around, I noticed that there's a podiatrist giving a talk, like he's one of the speakers at the expo, talking about foot stuff because it's running. And so I stop and I decide to ask him a question. So I tell him everything that I'm doing. Like, hey, man, I'm doing 2 million steps this month. It's day 18. I've already done 1.3 million steps this month. My Achilles is on fire, but I really want to run the 10K tomorrow. Do you think it's even worth the risk? Like, do you think I'll be okay? Like, I feel like this thing could snap if I if I put too much pressure on it. And he just casually goes, yeah, I mean, you'll probably be okay. Just make sure you're stretching. And I would put a heel insert in to kind of alleviate some of the pressure and the flexing of the Achilles, and should be good to go. And in my head, again, when I'm looking at people jog, I'm like, how are you doing that? Like, that's how much pain I'm in, to where when you see other people doing it, you're just like, I'm so immobilized. And he just tells me, just put a heel insert in and stretch. I'm like, I don't believe you, but I'm going to try it. So I walk from the expo to the convenience store. I get a couple of heel inserts. I put them in. I take them for a ride. All of a sudden, I can run with no pain.
Ah, damn.
So that's how I got through the pain. That's like through expert advice, I got through the pain. And so then the next day, I decided to end up running the 10K, and finished pretty well, top 100.
Damn, okay.
So it was a great experience overall, man.
It's insane that the fix was that simple, but you
Isn't
needed
that crazy?
someone to kind of, yeah.
I couldn't run for 10 days, and he said put a heel insert in, and all of a sudden I could run. That was kind of crazy.
Yeah, it's such a minute thing that you would never think about it unless someone's like, hey, this is the issue, just use this and then you'll be all good to go.
Mm-hmm.
Was all the time. Also, like, you're constantly in pain, so you're not worrying about, oh, how do I fix this? You like, my body is feeling like this. It's not like an outside source that's making me feel like this. It's insane that it was such a simple issue.
Yeah, and I could walk with no pain. Like, I could walk with no pain at that time. I just couldn't put in any significant force, like running during that time.
What was there a time when the whole running thing, was it a symbolism of kind of fighting against the whole idea of limited movement? Did it become that, or was it just serendipity in terms of you choosing to do that? Or initially, was it something bigger about the running side of it? Like in South Africa, for example, segregation, which was used to limit movement. And you chose a model of movement to kind of showcase that, oh, there's an issue in healthcare. Why did you choose it? Was it just serendipity, or did you just intentionally walk into it being like that?
Yeah, no, I would say it's more so serendipity, because, again, walking hadn't been a part of my fitness protocol ever until last year. And when I did my million steps last year, my resting heart rate actually got down to 42 beats per minute. And it hadn't been that low since I was like in my peak shape in college 10 years ago.
Yeah.
And so it just opened my mind to the power of walking as a tool to transform individual health. Again, and I watched walking transform 5-6 individuals' lives in a matter of a month. And so it was more just, it's more accessible. And these were regular everyday people. These weren't like superstar athletes or anything like that were doing the million steps in a month. These were regular everyday people who worked desk jobs throughout the city. And yeah, to me, it was really just like, this is way more accessible. Oftentimes people see me do things and they're like, okay, well, that's for him. That's something that Kwame can do, right? And walking is something that, again, most people could do, barring certain circumstances. And there's also another organization called Girl Trek. They've gotten 1.5 million Black women to take a pledge toward walking to revolutionize health for Black women and just transform life for Black women in this country. Honestly, one of the most effective public health interventions that exist to date, if you ask me. And again, as you put a product out into the market, like, you have one vision for how it takes off, but as it stands today, like, walking has just driven the platform. And so just leaning on what is driving the traction for us. And it's cool that you do point that out, that like using movement as like a way to revolutionize health. It's like, hey, let's move away from this system, and build our own. One step at a time.
Literally what you did, man. So we talked about the walking part, which was the spark the initial drive. But I want to touch on the app itself. Let's talk about the app. And how does that connect to the issue we're solving? What issues am I getting? And I want to touch on the scorecard that you have. Why did you initially touch on like, let me create a scorecard and this will be the guide that people will use?
Sure. Yes. So during the COVID-19 pandemic, my first thought, well, actually, my aunt texted me. So my aunt, she's a physician's assistant. She also went to Xavier, and she texted me and she's like, "Hey, Kwame, I'm just working in the clinic today, and everybody that's coming in is, a Black person. They have type 2 diabetes, they have hypertension, and they're the ones experiencing like the greatest, severest illness with COVID-19. And I just think this would be a great time for you to kick off your healthy eating initiative again." So I'm the resident vegan in the family. And that's kind of what she was referencing. And, my first thought was, I don't think we know how bad we're doing. I think we know we're not doing great. We know we need to be eating better. We know we need to be exercising more. But I don't think that most of us are aware of the short and long-term implications of our current health status. We don't know that if we don't get it together in our 30s, we could have a heart attack at 45. Like that's starting to happen. A stroke at 46. One of my mom's good friends lost her husband to a stroke at age 46 and left their 13-year-old son to have to grow up without a father. Strokes are preventable, especially at 46. And what happened to him is starting to happen more and more each year, right? It's getting worse with each successive generation. It's because, we're living worse lifestyles. We're exposed to more toxins earlier in life, and whereby our parents' generation, maybe they grew up on real food. And so maybe they just started eating the highly processed stuff later in life. And so it takes a while, it takes a little bit longer for the disease to manifest and, ultimately potentially take their life early. But we grew up on this stuff. And so now we're developing hypertension, type 2 diabetes, and cancers in our 20s and 30s. And our bodies can only live with these conditions for so long. And ultimately we live shorter lives. So it's not that Black people are suddenly dying early in our 40s and 50s in this country. Our bodies are actually just aging faster. Our bodies are getting older faster. And so someone may be 46 years old chronologically, but biologically on the inside, they're closer to 60 or 70 based on the wear and tear that their organs have gone through because of what they've been exposed to in their environments and the foods that they consume, so on and so forth. And so that's really what's going on. We're aging, we're getting older faster and ultimately dying earlier. But fortunately, you can slow, stop, and reverse the rate of aging at any age in anyone with lifestyle modification specifically. And so what I wanted to do was communicate clearly to the Black community our current health status so that we know where we are and basically your trajectory. And health is complex. And so I wanted it to be something that people could understand very quickly and feel some type of way about very quickly. And, a health score was the thought. And that was it. But I didn't want it to just be a snapshot. I didn't want to just say, hey, this is your health score, and then they go on about their lives. Like I wanted to create a system of follow-up. I knew I didn't want to just do another workshop or seminar that raises people's awareness, and then they're excited for a week and they're healthier for a week, and then they kind of fall off, and I have no idea what's going on in their lives. So I wanted to have a health score and then also a system of follow-up. And so that's where the idea for the app came as well. And so now I can see after someone engages with us, how many steps they're taking every day for the next, or, so long as they're on the platform, and how their eating habits are changing, how many events they go to that we host. And we can, as people trend in one direction or another, send different nudges or reinforcements to make sure that we're staying on track, because that's really what's lacking. There's tons of work being done throughout the country to improve health in the Black community, but most of them are one-off experiences. And the follow-up is little to none. And the follow-up is everything, and executing on anything. And that's the real value proposition that we have with Behr, like on an individual level, but on the community level, all of the user data goes into what we call the Black Electronic Health Record, which that's what Behr stands for. And we use that real-time data to inform and drive community health solutions. So we'll see the average health score overall. We'll see the average health score by gender, by age, average health score by the different categories of health that we track. So physical health, nutrition, mindfulness, sleep, mental well-being. And ultimately, we'll be able to compare and contrast the average health scores between different communities and cities and zip codes, right? So we'll be able to see the average health score in New Orleans compared to the average health score in Atlanta, or the average health score in US versus the average health score in Ghana. And be able to identify opportunities to take some learnings from where Black people are doing well and apply them to where Black people aren't doing well, so that we can, again, maximize health in the Black community. But Yeah, that's kind of how it started. It's just I wanted to communicate clearly to the Black community our current health status in a way that we can all wrap our heads around. And turned out people are interested in knowing their health score. Some people aren't. Some people are scared. But so far, about 2,500 people, probably like or 4,000 people actually have engaged with us and completed a health score assessment. And now we can see where everybody's trending. And honestly, since we started tracking the community report, the health score report, the average health score has increased by about a point per month. There's actually a 3-point jump in the average health score from last month or from May to June. And that's what we do is we provide real-time health education for individuals, and then we provide interventions, make recommendations to help improve community health, and we track that month to month. And really proud that we really started with a vision 5 years ago and now have this product that exists today and it's doing its job.
Yeah. And I want to touch on the point you touched on now, the data aspect of it all and the discoverability of knowing what's happening within this community, what's happening with that community. How important is it for the Black community to know what's happening within their respective communities and then touching base on, oh, this is what's working with this community, let's implement this within this community. How important is that aspect, and how is Behr going to help with regards to that?
Yeah, it's everything, because like I said in the beginning, this is about curating health promoting life environments and experiences. And what we're going to be able to find is, one, how do Black people, despite what we're up against in the country, become healthy, right? There are individuals throughout the country that have been able to transcend all of the injustices and maintain health and honestly thrive in the country. How did you do that? Let's go extract some of that information from those individuals. One of those individuals is my grandfather, who's 87 years old here in New Orleans, grew up in the Jim Crow South, but he doesn't have a single chronic health condition, and he's 87 years old. How did you do that? Can you come tell your story to our community so that everybody can learn from that? And what is it about your experience overall? Like, in addition to, like, let's say you living a healthy lifestyle, what are the characteristics of your environment that we can maybe duplicate elsewhere? Like it's really everything, because that's where we get to tell stories about communities, right? Because stories are everything. Stories are what get us to do things. It's why we get up every day despite the suffering that we face. There's a story that we believe in for why we should continue. And then also people like to feel like they're a part of something bigger than themselves. Like going out and improving your health for yourself is one thing, but like having a community that you're a part of, seeing the average health score in your community go up and knowing that you're a part of driving it up because you're working on yourself, I think that it really sets us apart as a health app, because most health apps are really focused on the individual. Not to say that there aren't community social aspects where people can, like friends workouts and stuff like that, but not only are you working on improving your health for yourself, but you're a part of this larger vision to improve health for the Black community. And you get to see those trends month over month in your community. And then we'll have competitions between New Orleans and Atlanta, and then in LA and New York. And just, again, focusing on the experience. And that's really where we're getting to as a company, moving away from just telling people, hey, go take 10,000 steps a day. Instead, we say, hey, go join this challenge. The ultimate outcome is everybody takes 10,000 steps a day, but that wasn't the focus. Or, hey, you should go on a run. Instead of saying, hey, go on a run, we say, hey, come to our run club meetup. Or instead of saying, hey, eat a healthy breakfast, come to our breakfast club sessions every morning. And it's really, again, giving people opportunities to swap 1 or 2 or 3 things out per week that they do on a weekly basis with one of our experiences that are health promoting. And that way, health doesn't feel like this extra thing that people have to do to be healthy. It shouldn't. What are you doing with the rest of your time if you're spending 10% of your time trying to be healthy? What is the rest of your time creating for your life? And how can we reorganize and restructure the rest of your time to where you don't have to do anything extra to be healthy?
And on the other thing, I want to touch on the launch that you prepare and the Behr Marathon. Yeah. How are you planning that? This virtual run that you're doing, you're trying to get a million people to sign up to run all together. Run us through that. How, and if I wanted to join, how do I go about joining?
Yeah. So we have 2 goals for this year's Behrathon. So Behrathon is kind of is going to be our annual virtual run/walk event where basically you just have to log a run or a walk on our app to participate. And this year the theme is Behr Health to the Moon, since this is our official launch. And so our goal is actually to cover enough ground as a community on Behrathon Day to reach the moon, which is about 239,000 miles. And so if we get 239,000 people on the app for the launch, then everybody only has to walk a mile. But if we get, 100,000 people on, then everybody's got to do, 2.3 miles, so on and so forth. So right now, that's the main campaign is like, and we won't know until Marathon Day how many miles the marathon race will, because we will do an official race here in New Orleans for Marathon Day. And then the ultimate goal of the marathon is to break the world record for the most people participating in a virtual run/walk event. Now, whether we accomplish that this year or we accomplish that next year, that's the ultimate goal. How can we get 1 million people to move toward transforming and revolutionizing health in Black communities? And yeah, that's really what that's about. So in order to participate, you can go to our Instagram page and you can find our link tree and you'll be able to see, I think it should be the first or second link on there. You'll see register for the marathon. It's free to participate. When the official app comes out in October, you'll download it and you'll sign up. It's going to be free for the first 3 months, most likely. And then it'll be $5 per month or $50 per year to use the platform, be a part of our experience. But yeah, you'll be able to participate in the marathon for free and be a part of that movement. If you don't want to be here anymore, by all means. But we encourage you to stay because, again, whether you need personalized health coaching or not right now, you being on the app, you being a part of the Black electronic health record, helping us understand where Black people are thriving or where Black people are struggling, will just help us execute on our vision to maximize health and ultimately become the universal health provider for Black people. So you can imagine a nationwide network of wellness centers, what we'll probably call Behr Connect, all connected to the app. So long as you're on the app, we'll know your history and be able to provide you tailored care. And that's the ultimate vision. Our goal is ultimately for the app to be free for everybody based on the finances to start. Based on the way my bank account is set up in the beginning, we're going to have to we're going to have to charge, but that's okay.
And the other thing I want to touch on is the aspect of community. How important is it to build a community around your app, especially early stages of anyone's founder? You need to build a customer base. How important is it to have that community at an early stage when you're building an app to get that validation of, well, there's actual need of what you're building within the ecosystem you're building for? How important has been having a community with regards to validating your app, finding a customer base early on?
Yeah, it's been it's definitely been just like a truth of our experience that community is at the core of everything that anyone builds, especially from the ground up. Because again, you're competing with the world for attention. You're not just competing against health companies. You're not just competing against startup companies, whatever that's in your industry. You're competing against everybody who's trying to get anybody's attention in the world. And so in the beginning, I was often taught that you want to do things that don't scale. So that's like one-on-one meetings with potential customers, users. You're trying to get to where you have 1 million users on your platform, but you need to be willing to spend time one-on-one with one person who's one user who's contributing to your community in the way that they do. And do that again. It's a volume thing, man. Like you got to talk to a lot of people to give yourself the best chance. And so I wouldn't say that I necessarily leaned into community as much as I should have in the very beginning, because I was so focused on growing the concept, right? And this is before we had an app. When we were doing health score assessment interviews just on our website, I was lost on the idea of community in 2023. And in 2024, when the run clubs and stuff started popping off, I was reminded of the importance of it because these communities were growing at a rapid pace. They had a very simple product, meet up here and jog with us or run with us or walk with us. But people were coming in droves. But it reminded me that people more than anything need community. And it is actually the first step in our blueprint to health, which is community and purpose. Before people are going to care about any of this health stuff that I'm talking about, how to eat healthy, how to exercise the best, or whatever product or service you're selling, before they care about any of that, are you solving that community problem for them? That's a problem that everybody has. And so if you can solve that, then they're going to be interested and open to whatever you're doing, honestly. Well, people right now, so I run a run club, kind of attached to Behr Health. People hate running. People literally hate running, but they show up every Sunday morning at 7 a.m. to run with me and my run club. Every Sunday morning, like clockwork. Under normal circumstances, they would not be doing that. If they were by themselves, they would not be doing that. But we have solved the community problem for them in a way that's valuable to them. And so it's everything. And it's going to become increasingly more important as we continue to kind of be isolated by technology as individuals in real life experiences, in real life community. It's so clear that it's solving a big problem. And that's what I love so much about run clubs. They're just community wellness or community anything. It doesn't have to necessarily be related to health. Find events or experiences that are happening around things that you're interested in. Or if you're a founder, go to these events and experiences that are related to the product or problem that you're solving, and just go in and be a part of the community. Whatever your agenda may be, may come up, may not, and it's also better when it kind of is discovered. And I'm not saying going in on some covert operations kind of stuff, um, but show up, contribute, bring value to the community, and when the time comes, people will start asking about like, what's going on in your life? What do you do? It's like, oh, hey, I run this health app. I'm at this run club. I run this health app. I get people health scores, and oh, that's really cool. We should collab. Boom. You didn't have to make the pitch. You're just there as a part of the community. It's just more genuine that way. Yeah, but it's everything, man. It's what we have lost, and really in the developed world is community. Because everything can be kind of done for us by technology in some sense, but not that. Although I don't know, we'll see what happens with this AI stuff. People seem to be falling in love with these agents, so I don't know. Maybe the agents can solve community. We'll see. To be determined.
Definitely. So as we reach the end of our conversation, there's one question I want to touch on. If I'm a listener listening right now and I am planning on shifting my health regimen, what's the first few things do I need to look at to kind of shift whatever's not currently working for me? What are your go-to things that you usually go, if you want to live a healthier life, this is what you start with?
Yeah. I think fear is a big part of it to start, depending on the person. I think people need to get clear on like what is at risk, right? Because your health isn't just about you; it's about being here for your family. So do some soul searching on the why. Like it needs to be more than I want to be healthy. Being healthy isn't strong enough a motivator, honestly. And the food tastes too good. Unless you're one of these people who just kind of like, can just sacrifice all things to an end no matter what, just because you conceptually understand, rationally that it's good for you. Like you got to find something deeper than I just want to be healthy. It's interesting though, like when people don't have their health, it's all they care about. Nothing else matters. I think that's an important thing there to recognize. And maybe that perspective is what people need to focus on it, despite how good the food is. But, again, I have three kind of core components when it comes to transforming your health in any specific way. One, you need a goal. So this could be, I want to start running more. Very simple. I want to start running more. Or I want to start eating better. Cool. Second, you need some form of timeline connected to an event where you kind of showcase or display what you've been working on. So let's say you are wanting to eat healthier. Well, there's this cooking demo coming up in the city in 3 months. Okay, so I want to make sure that I can show out my healthy eating or healthy cooking demo by then. Or there's a 5K coming up and I want to be able to finish the 5K, or I want to do it in a specific time. And then the third component, the most important component is a community of people to do it with. If you get those three things, then again, notice I didn't say like your goal is to do 10,000 steps a day, or your goal is to run 2-3 miles a day, like to be healthy. It's like, no. You need to focus on these things. What is the objective? The ultimate objective is I want to be a consistent runner, let's say, or I want to be able to cook healthy meals for me and my family. You need something time bound so that you don't just let it drag. That's a key component too. So a 5K that's coming up in 3 months, some sort of cooking set, or you just plan an event. It doesn't even have to exist. You plan an event. Hey family, I want to display for everybody my healthy cooking skills. And you plan a family dinner or a community dinner, or you can put that on display. So now you got 3 months to prepare and become somewhat proficient at that. And then find a few people who maybe have the same goals. And then you guys do it. And that's life, man. That's life. This isn't like some strategic, counting of your calories here and there, or walking 10,000 steps a day, or, hopping in the cold plunge, studying your VO2 max, like all of that stuff. Track everything. I'm a big proponent of tracking everything because we can't improve what we aren't measuring. But that isn't the focus. So that's what I would say. Yeah. Set a goal, time-bound goal, have an objective, overall broad objective, and find a community to do it with, even if it's 2 people. One other person. That's all you really need.
Yeah, definitely want to getting back to everything else. It's that whole take one step at a time thing. And the last thing, if people want to reach out to you, where do they find you?
Yeah. Yeah, please do reach out to me, right? I'll respond to DMs, well, depending on the platform. I'm not really on Twitter much, but Instagram, I'll respond to
And which
DMs.
platform is that? Do they go to LinkedIn, Instagram? Where do they find you? By
Yeah,
email?
you can get in touch with me on LinkedIn, but most active on Instagram. And so our company account is Behr Health, Behr Health, and then my personal is Kwame Terra, KwameTerra. And yeah, just you should follow us for sure. Most importantly, though, download our app, be a part of our community. We have a community manager in the app who is essentially like your hype man or woman. And basically, if you download the app, again, our beta app is out right now. It's called Dacadoo, DACADOO. Use access code GARAGE to get in, all caps. Create your account, complete your health score assessment, and then track your changes over time. Join our events if you're local. Join our challenges if you're not. And be a part of the community again. And then our Behr Health account will kind of like all your workouts, comment on your workouts, ask you random questions about your life. And yeah, just be a part of our community until the Bearathon, and then we'll migrate over to the official app. And really, really get things going, because we haven't really tried to grow in a real way because of the inconsistency between our brand and the name of the app, our beta app currently. So Behr Health is the company name, but then it's the Dacadoo app. So that's been confusing people. But once we have that consistency in a few months, then we'll start
you'll have a whole system. And okay, once again, man, thanks for being on the show. And that is all from us. And look forward to hear from us on the next episode of From Garage.